YouTube, how are you? How you all doing? And welcome back to the channel. It's your girl Miriam Chi here. How are you? I miss you guys. Okay, guess what I have today? This topic is men problem. Not really men problem, because it affects women as well. If this thing don't work, the women are in trouble, and most times it leads to relationship breakdown, marriage breakdown. This is one of the major causes. We're talking about dysfunction today. What are the causes of erectile dysfunction? That is what this video is all about. Before I dive into that, if you have not subscribed to this channel, please subscribe and become part of this community. So if you see me looking down, okay, I've done my research. I have my book here, okay? So erectile dysfunction, yeah. This erectile dysfunction affects 1 in 5 men. If there are 5 men standing by the roadside, there's possibility that one of them have erectile dysfunction. So that's to show you the percentage is quite high. So it's not something we can. What is erectile dysfunction? It's inability to achieve erection or inability to sustain. Some people achieve erection, but it does not last. Why some people cannot achieve erection? This is common among middle-aged men, let's say from 40. There is also some younger population that have also suffered erectile dysfunction, but majority from 40. So what are the causes of erectile dysfunction? Number 1 on my list is medical condition. So medical condition like people that have high BP, high blood pressure, high cholesterol level, Parkinson's disease. You know, Parkinson's disease affect the nerves, and if the nerves is affected, there's possibility that the reproductive area will be affected as well, because the nerve is what supports it to sustain the erection when it's achieved. And prostate enlargement, prostate cancer can also be a cause, and even diabetes and other conditions that I have not mentioned here. There's so many of them, but I can't mention all of them. I just mentioned but few. Then number 2 on my erectile dysfunction is lifestyle. If someone is taking a lot of cigarettes, it does not have any health benefit whatsoever. So if you're taking cigarettes, you have to also think about the negative implication on the other aspects of your life, your health in general. You know what tobacco does to the veins? Tobacco inhibits blood flow, blood supply to the arteries and veins, and if this thing happens on a long run, it leads to erectile dysfunction. Alcohol intake as well. If you're taking alcohol, at least take it in moderation. Anything done in excess is a problem. Alcohol causes erectile dysfunction. Obesity. You have to watch your weight. Once you become obese, there's so much complication, cardiovascular disease, this and that, stroke, other things just come up. So obesity is one of the major causes of other illnesses, okay? Once one becomes obese, this comes up, this comes up, this comes, you know, it's like bunch of illnesses, bunch of conditions, they start cropping up. So you have to use and substance abuse. You know, people that take drugs, they say they get this relaxation, this relief. Listen, after that, what happens? So you have to say no to drug. It does not do you no good. Maybe it keeps you satisfied at that moment, but that is just it. After that, nothing else. And also excessive use of Viagra. There are men who cannot depend on their natural ability. They always want to take this to satisfy their partner or this listing. As long as it's your partner, your wife, I mean, do you have to keep hiding? You have to do what you can, mom, and leave it. You don't have to keep ingesting tablet to satisfy, to prove yeah, macho man or whatever. All this thing don't work. The more you use it, the more you're likely to depend on it, and it's going to destroy you finally. This thing is going to lie down and not wake up. No matter what you do, boy, it's not going to get up. So you better stop depending. Number 3 causes of erectile dysfunction is certain medical treatments, like people that have undergone prostate surgery, cancer treatments like chemos and radiotherapy. You know, God help us, these things are not good for the body. I have seen somebody who has gone through chemo and radiotherapy. It just destroyed this lady's immune system. She became susceptible to other sicknesses, and within a couple of years she was gone. These things, God help us. God help us. We don't get sick. The effect of chemotherapy and radiotherapy is really massively disruptive. Okay, it destroys the cells, the internal organs of the body. It weakens your immune systems and all that. So these things can cause erectile dysfunction. Then another thing on my list is medication. Medications like antidepressants. One time, one of my lecturer was teaching about reproduction and all that, and he made a joke that people that are taking some medication like antidepressants and some other medication he mentioned, he said, like, especially men, they are not able to perform in the bedroom. It cripples or inhibit or limit them to some extent, while some people just destroy their libido completely. So he said a patient asked him, oh, this patient has been prescribed this antidepressant, and the patient went like, oh, what about my bedroom business? How do I do it? Then the doctor was like, you have to choose this medication or your bedroom business. One must happen. Which one is most important to you? So that was the question that was given to this guy. So most of these medications, they have negative side effects. Some of them are just massive, while some of them, they're almost invisible. So most of these medications, like antidepressant, antihistamine, and high blood pressure medication, they make the male reproductive organ, should I say, ineffective, or they just put the thing in silent mode. Okay, so these medications, you have to be aware of them. If you're having this problem, erectile dysfunction, check your medication. Go and check the side effect of the medications you're taking. Just Google it up, or better still, ask your doctor or something. It may be the result why you are experiencing this thing. So at least if you know that is the medication, at least you'll be aware, you know what to do. Continue your medication, or ask for an alternative prescription, something different from what you're taking that can do the same job. At least you know that, yeah, is this medication. It's not that you just woke up one morning and missed a refill. 5 on my list is psychological problem. You know, stress, depression, anxiety disorder, everything. If you're not happy with the environment, it's going to affect you in one way or another. Some people, it gives them some known medical condition, while some people, it affects them in a way that is invisible. Like, especially right now, people that are living in UK, they will attest bills have kind of tripled, and food stuff, everything has gone up. So it's really hard, and bills and rent, they are all flying up, but wages are still as stunted as ever. So all these things can just stress, distress. So when you are distressed, it's likely going to affect your sexual life, and this is one of the impacts. Erectile dysfunction, it will knock down your libido. If someone is stressed, do they ever think of sex? No. Who thinks about it? You only think of sex when you're relaxed and everything is okay for you. But when you are faced with a lot of massive difficulties and challenges, man, sex will be the last thing on your mind, isn't it? Am I wrong or right? Please, if I'm wrong, correct me, comment in the comments. Then what are the effects of erectile dysfunction? We all know that if you cannot do your bedroom business, there will be crisis in your marriage, your relationship, unless you have a very understanding and supportive woman. If not, most women cannot cope with this. So this is one of the major causes of relationship breakdown, marriage breakdown. Number 2 negative effect of this is it causes anxiety, stress, it destroys your confidence. If a man cannot perform, that's really bad. I mean, I can imagine how the man feels. It's like it just knocks off your confidence. You just develop anxiety disorder from nowhere, because you're thinking, okay, this is what I have to do. I have seen this food, I want to eat it, but I can't eat it. This thing cannot wake up to eat this food. I mean, that will make you become stressed and depressed, and it will just trash up your confidence. It will just mash you up. Your egos and emotions and everything is at stake. You likely going to have a reduced or completely wiped out sexual urge. The person is likely to become infertile. Obviously, if you have erectile dysfunction, I mean, the reproductive organ has to be erect to be able to do its business, do its work, to be able to achieve pregnancy. So if boy refuses to wake up, there's no how pregnancy can be achieved unless it's done artificially. Prevention. How can you prevent this? Treat any health conditions, any STDs, any whatever. Make sure you get it sorted. If things are left untreated, it develops into a massive problem. I mean, if something is just like 1% problem, if it's left for months, it's likely going to become 10%. And if it's left for years untreated, who knows, 50% or 60% or completely 100% thrown out. So make sure you treat any condition you have, and even conditions like psychological problem, depression, stress, anxiety disorder. Get treatment, get therapy. You know, sometimes problem just talking to somebody, it makes you feel better. So please talk about your problem. Seek for consultations and therapies. It will help you. Then quit alcohol, cigarette smoking, and substance abuse. Quit them. It's not going to do you any good. Maintain a healthy lifestyle. Maintain a healthy weight. Go for your exercise. Keep fit. Keep healthy. You'll be alright. Eat healthy meals. Incorporate fruits and vegetables into your meals. Eat fibers. Avoid fatty foods, sugary food, all those processed food and processed meats. Say no to them. They are not good for you. So thank you for watching this video, and please, if you have not subscribed, I'm begging you, subscribe now. Subscribe and support your sister. And do look after yourself and take care of yourself. Until I bring the next video, bye bye. God bless you. Mwah.